Well, welcome everybody. It's Chip Rogers, President and CEO of the American Hotel and Lodging Association. And you're probably asking yourself, wait a minute, why does Chip not have the AHLA banner behind him? Why does he have this thing around his neck? And why is there somebody else with me? We're going to answer all those questions, and they're good questions to ask. We have a very special edition of the forum this week, as we're talking to two gentlemen who help lead states that are at the front lines of returning to normalcy for travel, and in particular, travel that involves people that have been pent up for a long time looking for a wonderful time, a vacation, and what we commonly term as leisure travel. So we'll get into that in just a second. But my two guests on this, not on the screen, we'll bring him up in just a second, but with me is Josh Green, who serves as the Lieutenant Governor of the great state of Hawaii, which probably answers this question right here. And this behind us is we're at the Outrigger Hotel here in Honolulu, and what a wonderful, incredible place. We'll talk more about that in just a second. We also have with us the Attorney General of the great state of Nevada, Aaron Ford. General Ford, as you can see right there, has done just an amazing job leading a state that is incredibly dependent, like Hawaii, on people coming to visit that state. We're going to talk a lot about that in just a second. But I always have to remind folks that none of this is possible if we don't have people who sponsor us, who support us. And so we certainly want to thank our sponsors, Food Buy, Hodges Ward Elliott, and Spencer Stewart. As I've said during the entire pandemic, you know who your true friends are during your toughest times and who steps up to offer support. And these folks have been with us since day one. So we want to thank them for supporting our industry and supporting AHLA. So it should come as no surprise to you, Mr. Governor, or to General Ford, what this has done to our industry. And particularly in your two states of Hawaii and Nevada that are so reliant on people with leisure travel. And I want to get into that in just a second, but I really want to set the stage of what it's meant for job losses. Because this is the thing, I guess, when you talk about what has happened beyond the medical situation that has cost people lives, which we can never, ever overshadow that. That is the most important thing. But for those who are impacted this way financially, these job losses in the state of Hawaii, over 20,000 hotel job losses alone, that's the direct loss. In the state of Nevada, more than 40,000 hotel job losses. It's devastating. It impacts people's livelihood. It impacts their mental state of mind. It impacts their physical well-being. It impacts communities in a very negative way. So this is serious stuff. One of the things we've done before we get into the questions, I really want to make sure we mention this, is we've worked with Senator Brian Schatz right here in the great state of Hawaii to introduce the Save Hotel Jobs Act. Now, this piece of legislation is aimed directly at hotel employees, particularly those who are unable to work right now, so that we can continue to compensate them, to bring them back on the job sooner than we otherwise would, and make sure that we're financially supporting the people that make our industry so very special. As many of you know, last week we held a press conference. Myself and the head of the hospitality union, Unite Here, probably one of the first times we've ever been in a room together, both championing the same issue. But you know, when we can find things to agree on, we should always work together. There's no question about that. And one thing we can absolutely agree on is that the employees in our industry have been hurt in a significant way. They need our help. They need assistance to continue to get through this, because we're not going to be out of the woods overnight. It's not going to happen next week. And when you think about the devastation that has occurred over the last 15 months, it's not like a light switch that everything is going to be good just because you flip the switch. So they need our help. We'll continue to support that. But I want to talk to these two gentlemen about what's happening in your states. And so first, Mr. Green, we'll start with you. This state, stunningly gorgeous as always.
Thanks.
I've been to Hawaii quite a few times. I come back. There's a little fewer people here. But I get this sense in talking to everybody, just a level of excitement that they can start to feel that we're returning to normal. Kind of walk us through what it's been like over the last 15 months and kind of where we are today.
Sure. Well, thank you for having me, Chip. I can't put too fine a point on it. It was an existential crisis for our state, for our people, from the healthcare standpoint. As an emergency room doc, I see that part of it. And then for our industry, our hotel workers, our hotel owners, our investors. When I say existential, I mean literally it was an existential crisis. So back in May, I should even flash a little further back in March of last year, when it was clear that COVID was going to surge through Hawaii and through the United States, the the decision was made to prevent the largest carnage that we could. We projected at the time 4,479 fatalities in Hawaii alone. And though it has been heartbreaking to see any loss of life, we've instead had 485, so 90% less. But that decision to lock it down, to shut down travel here, meant that we decreased travel by 99.6%. So we went from about 30,000 visitors a day on average down to just a couple hundred. And you know, of course, what that meant to our hotels and our workers and all of our families. So we had to get out of that. We had to protect ourselves from COVID so that our hospitals didn't become overrun, so that we didn't have mass casualties amongst our kupuna, it's the word we use for our elderly here. But we also had to look at the economics. And what that meant was I built a program with our team to gradually get us open, which we called Safe Travels. And so now that's worked. Here, 6 months into Safe Travels, which we launched on October 15th, kept our cases way down, lowest in the country for average case rates, mortality rates, and so on. But we've been able to return 3 million travelers back into the state of Hawaii, some returning. And that meant some reopening of jobs, of livelihood. And so the existential crisis passed, even though there were still cases around the globe. And I'll finish with this. What we know is that this is our largest and most important industry, travel, tourism. We know that for every 50 people that come to Hawaii, it creates about one full-time job for a year. And so we thank you who are watching and thank the teams that make these wonderful hotels that live and exist and hire individuals. So we knew we could do it, but it was very challenging because COVID is contagious and we don't have immunity yet fully. We're getting there. By about July 1st, we think we may very well have herd immunity in Hawaii, which will make for more possibilities, which we can talk about if you like.
Yeah, I definitely want to talk about that. And I want to talk about how you've been so successful, because I hope and pray that out of this, we were able to take an honest look back and see what worked and what didn't work.
Yes.
General Ford, let's go to you. Nevada, much like Hawaii, is so dependent on people coming there to have a fun time. It's a different type of fun, but nonetheless, it is fun. And in our industry, I usually find myself in Las Vegas 4 to 5 times a year. And I was just mentioning to somebody earlier, this has probably been the longest stretch of my adult life that I've not been to Las Vegas. And I'm itching to get back, excited about it. But kind of walk us through what has happened in your state to see the photos of the Las Vegas Strip with nobody walking on the street was shocking. And luckily today it's a little bit different.
Yeah, well, first off, you got some catching up to do since you haven't been here in a little while. Let's just go ahead and get that calendared out. And let me pay some homage to Lieutenant Governor Green. Thank you so much for the work you've done out there. Aloha from the ninth island, as we call Las Vegas. We are quite proud of our industries, our tourism industry in particular, and as you've indicated, it's the heartbeat of our state here, at least in Southern Nevada. And so it hasn't been the best of times. And I'll tell you, you talk about the pictures of the Strip being empty. I remember driving home probably this time last year from the office after we had shut a lot of stuff down, essential, non-essential, and whatnot. And I was on the highway. I should have been happy that my commute was 10 minutes instead of 40, but I was a bit dismayed, frankly, and I would have traded a 40-minute commute for that 10-minute commute that day for anything. And so I'm glad a year later we've done a lot better. The ongoing COVID-19 pandemic obviously has impacted Nevada, the Nevada economy in so many unprecedented ways. Nevada's economy is highly integrated with global and national economic changes. You hear us say all the time that when the country gets the cold, we get the flu. And we're heavily reliant on the tourist and hospitality industries. As a result, we experience significant increases in local and statewide unemployment and fiscal stress on the budgets of all of our local, county, and state governments. In Las Vegas alone, according to the Las Vegas Convention and Visitors Authority, overall visitor counts have declined from an estimated total of approximately 3.7 million total visitors in October of 2019 to an estimated 1.9 million total visitors in October of 2020. And that's a significant hit. But what I like to tell concerned Nevadans is that we're strong. We're a resilient state and we will bounce back. In fact, we already are bouncing back. Vaccinations have been making all the difference here in Nevada. And we've been vaccinating eligible Nevadans quickly and efficiently. And just today, in fact, our governor touted new budget projections that have us on pace to received $583.2 million more in revenue than was previously projected back in December. So clearly things are looking better than they were. I don't think we're quite back to where we were in terms of tourists pre-COVID, but we're certainly doing much better in 2021 than we were in 2020. And flights into Vegas are at full capacity. I happen to be going back and forth to Carson City because we were in our legislative session. And in February, when it started, it was not a long wait to get on those planes. And now that I'm coming back and forth more frequently, I'm seeing more and more people get on these planes with me, even from Reno coming down to Vegas. And so when I get to the airport here in Vegas, it's more packed every single trip. And so, they're at full capacity, and you'll start to see our events slowly reopen this summer, which will help us continue to stay on track. The governor intends to reopen Nevada 100% capacity, with the exception of keeping masks on, obviously, on June 1st. Some places are, I think Las Vegas, Clark County in particular, in general, is opened at 60% maybe. I don't want to be misquoted on that. I could be wrong, but everyone's moving toward trying to get to 100% by June 1st. So we're excited about that.
We'll stay with you for just a second, General Ford. First, you mentioned airports. I never thought I would say this. I travel in and out of the Atlanta airport a lot, which is the world's busiest for like a quarter century now. And a few weeks back, when I walked in the airport, I saw a line of people, and I was happy. I could not believe I was happy to actually see a line in the airport. Usually, when I walk in the airport, I see a line. I'm like, oh, I should have left the house earlier. But this was so nice to see people back traveling again. But what I would like to get your thoughts on, your relationship, your office, your governor, working with private industry, I think has been one of the best examples of how to have safe events and travel that I've seen anywhere in the country. From the get-go, I remember receiving way back in March, I believe it was March or April of 2020, a document showing all the cleaning procedures that were happening at the Wynn properties. And it was astounding the level of detail that they went to keep the consumer safe. Tell us a little bit about the experience of government working with private enterprise to make sure that this is working in Nevada.
Well, you hit the nail on the head. It's going to take cooperation and coordination. I think just today or yesterday, Wynn Resorts indicated that 88% of their employees are vaccinated, which is great news for those who want to visit and have less concerns about contracting the disease. We have a good number of us here in our state that have actually been vaccinated as well. So that coordination, though, among industries, frankly, not just the tourism industry, but industries across the board, has been of paramount importance to us. But specifically with the hotels and tourism industry, we have a gaming control board and a gaming commission that likewise work hand in hand with those resorts, and they've done yeoman's work in trying to ensure that social distancing requirements were being met during the times when we were reopening, that cleaning requirements were being met during that time period as well. And it's proven that it was worth the struggle, so to speak, because again, places like Wynn Resorts and others are having good numbers there. Cosmopolitan, I understand it, is trying to convince its employees to get vaccinated with certain incentives and things of that sort. So, I enjoy looking at private industry doing what they can to work with the public to help get us out of this.
And Governor Green, you mentioned it earlier, you bring a very unique perspective, emergency room doctor and policymaker. Tell us a little bit about how you've accomplished what you've accomplished here in Hawaii. Obviously a unique situation because you're an island and people have to fly in, so you have more control of people coming in and out. No question about that. But that's not the only reason you've been able to have the success that you've had. And we talk a lot about this and the importance of looking backwards and saying, okay, what has worked? You guys have had the lowest numbers in the country. What got you there? How did that happen?
So I would just say this, we use analytics. As a doctor, I always try to base whatever we do on science, because otherwise you run into a lot of political conflict and you run into a lot of doubt, and it's better for people to just see the numbers. So I share the numbers very openly with our state. I even put it on a whiteboard, and every day, just for about 60 seconds, 90 seconds, my social media, it's at LTGov Josh Green, so you can see how we do it. Show the numbers, show the raw numbers, show where the spread's been. And by doing that, we were able to gain confidence from people. And the confidence was necessary because Hawaii, like I said earlier, we were in an existential problem or case of losing everything if we didn't get open on some level. So we had to have that confidence. We achieved that. And then we put in some policy measures that, though not easy to stomach at first, made the difference to open up. So what we did was we looked at what the probability of having cases come either from Asia or from the mainland, whether it's Las Vegas or LA or New York or anywhere, all of our main markets. And we said to ourselves, what would make it both safe and palatable for the local Hawaii residents to welcome back travelers? And so we looked around and I studied other people's models, and we determined that a pretest, though not perfect, but a pretest within 72 hours of one's travel would reduce by a significant number of the cases. Because we didn't want to stay shut forever. We knew that that would destroy people's lives, their businesses, they'd leave. They couldn't possibly manage, couldn't pay for ambulances, couldn't pay for public schools. So the pretest allowed us to reopen, and those analytics and that confidence got us there. And so the pretest with everyone's very familiar with our Safe Travels program probably now. A pretest, it's a swab, nucleic acid amplification test, that's the PCR test. It decreased by 88% our case rate. And so it wasn't travel related that the cases would be. It was community spread. And I made sure our Department of Health was very deliberate in describing when there was spread from visitors and when there was spread from local residents and in the workplaces and what kind of workplaces. Right. So all of those analytics gave people confidence so that we could open up. And when it comes time to open up even more and decrease restrictions or allow people to travel if they just had their vaccine and they have a vaccine card, we're about to launch that. Your vaccines are completed plus 2 weeks, you're immune. Then instead of doing the pretest, you will show that vaccine card. Some people will still bicker about things, but if they know that it's transparent, if you have a respectful conversation with people, then I found that almost everybody accepts it. And that's how we approached it and kept our numbers low.
And I think it's really interesting too, you point out that by having those tests of people coming in, you're able to identify whether that's the problem or that's not the problem. And if it's not the problem, then you need to look elsewhere, right?
Yes.
That is, I would imagine, really helpful, and a design that I think others should look at. Of course, it's much more difficult if you live in a state where people drive in and out.
Well, I'll tell you, that was actually one of the cases I made to the cabinet very early. I said to them, you have to realize right now, where are we? Back in March, April. Right now, there's no one coming and there's no cases. Now, when we open up, if we don't do it well, people will blame the other. And the other in this case means people from the mainland, people across Asia. If that happens, that could cause irreparable damage to our relationship between travelers who we love. They will be blamed. We can't have that. That could unravel the fabric of tourism for the long term. And so I was very clear that that had to happen because we have not had that. I could have imagined terrible circumstances. Right. And fortunately, none of that happened. And it was because of that deliberate process. And so we've now learned a lot of lessons, all of us, definitely General Ford, you, all the industry, me, we now know better. So if, God forbid, another challenge like this occurs, we can get there much more quickly to our solutions. We know what did work. We know what best practices were. And now I'm advising countries all over the world to tell them what we experienced, whether it's Israel or American Samoa or other states, because though Hawaii is unique, other states will have to wrestle with some of these questions of how they perceive visitors.
Absolutely. General Ford, you have done an incredible job yourself, your office, and your state of getting people vaccinated. How have you used your role and, for lack of a better term, your bully pulpit to remind people that if they want to get back to normal and they want to do it soon, then they need to get vaccinated, because you've had amazing success there in Nevada?
Well, that's a great question. I appreciate that. And actually glad to hear, Lieutenant Governor, you guys are moving to the show your vaccination card you can get in, because I'm going to be in Maui on June 14th for the Attorney General Alliance meeting. And I've already been vaccinated, and it's a great segue to the question there. So listen, I received my first and my second dose of COVID-19, the COVID-19 vaccine already at the beginning of the year. And when I got my first dose, as an African-American male, I was able to speak to, I think, some of what most folks know is vaccine hesitancy in the African American community, based on historical discrimination and historical issues in the context of medicine with the Black community. For example, the syphilis experiment down in Tuskegee. There were a lot of Black people who were concerned about this, and so I tried to use my, as you say, bully pulpit to encourage not just obviously Black people to take the vaccine, but all everybody to take the vaccine. And in my fraternity, Kappa Alpha Psi, which is a historically Black fraternity, we do what we call step shows. And our step shows, we use canes, red and white canes. And I'm a little old now, so my game wasn't as tight as it used to be. But after I got my shot, I did a cane routine, or at least I posted a cane routine on my Twitter account. Just again, trying to encourage folks who knew exactly what I was talking about to get that vaccine. And it's just trying to find ways to be creative to convince folks that they should be excited as opposed to having trepidations that they do. And to be sure, some have trepidations, and they had to address those, or at least have conversations around those. And so when I had my second dose, I even took advantage of that opportunity by having a great conversation with a local doctor, this time an African-American doctor up north in Carson City, Dr. Jason Collins, about the importance of getting vaccinated. And we recorded it and we put it out on the PSA form in order to dispel some of the misinformation circulating related to the vaccine. The conversation made waves throughout social media. Both of mine did, both the caning and the conversation, and was widely distributed to help those who may be skeptical about receiving the vaccine. Since vaccinations have become more available to the public, I've also been very open in making sure that Nevadans and minorities understand why it's important to get vaccinated. Over generations, as I've indicated, minorities were at one point used as subjects in medical experiments and tests and even case studies. And the lack of equity, fairness, and equality in the medical world is prevalent. And so we wanted to address that. You can't ignore it. And if you ignore it, then you do more harm than good. And so as part of a minority group, even more vulnerable to the virus, this vaccine is all that more, much more important. And so this past weekend, for example, Está en tus manos. It's in your hands in Spanish. Worked with Walmart, Mi Familia Vota, and they hosted a COVID-19 vaccine drive to reach residents in vulnerable communities. And I was out there speaking to Nevadans about the vaccine and encouraging them to receive it. Bottom line is this: vaccines work hand in hand with us trying to move to some level of normalcy, and it helps your immune system obviously to fight this virus, and it helps your body fight COVID-19 if you're exposed. And so, I continue to encourage everyone to do their part by getting vaccinated, help yourself, and help others.
On that point, we've seen so many partnerships spring up and so many amazing ideas. Just recently saw where the New York Mets and the New York Yankees are telling folks if they come to the game and they get vaccinated, they'll vaccinate them at the game. I'm assuming on the parking lot or wherever they do it. And then they'll give them free tickets to another game, which I thought was pretty interesting. I'm certainly not a Yankees fan, I'm a Red Sox fan, but I got to hand it to them for at least thinking outside the box. They can keep losing baseball games. I'm okay with that. I want to stay with you just for a second, General Ford, to talk about what you were able to accomplish, which is fairly unique. And I think it should be a guidepost for other states around this issue of liability protection. Nevada was able to do something which is sometimes very difficult to do, and that's to get everybody to agree on something like this in a very delicate way, but to provide at least limited protection for businesses who are trying to do their best, and the hotel industry is certainly in the middle of that, trying to deal with something they've never dealt with before, but also trying to keep themselves out of court. And so I want to thank you for that, but I'd love to hear about your experience with that.
Yeah, actually, I'll have to accord that to where it should be, and that's with the governor and the legislature and the industry. I, as Attorney General, actually got to sit back and watch this take place. The truth of the matter is Nevada, as I've indicated, thrives off of our hospitality industry. And when COVID-19 hit our state, we were knocked down hard, and thousands of hospitality workers were out of jobs. You've talked about those numbers already, and small business owners were struggling. And so Governor Sisolak held a special session and signed Senate Bill 4, so that we could address some of our state's crises and help Nevadans. As he said at the time, extraordinary times call for extraordinary measures. And since then, we've been seeing our small businesses come back stronger, and our hospitality workers and casinos stand back on their feet. It's going to take some time for us to come back, as I've indicated, completely from the economic shutdown, but they were able to sign legislation to provide some level of immunity for casinos and culinary workers, and work hand in hand to make that happen.
And we thank the Governor Sisolak and the legislature for working on that. Not an easy issue. None of these issues are easy, but it does afford businesses a little bit of peace of mind. They can continue to try to do everything in their capabilities to help the consumer while also get themselves financially back on their feet. So Governor Green, let's talk quickly about the vaccine rollout here in Hawaii. Again, like Nevada, it's been an amazing success. How did you do it?
Well, as you know, we have a bunch of islands, right? So we had to look at it from that perspective. We had to go out and not just vaccinate those on Oahu, where about 1 million of our 1.4 million people are, but we had another 400,000 individuals that are living on the neighbor islands, many of the most beautiful places. Right? I'm the doctor on Big Island when I'm not at the LG's office. So we had to be very methodical about things. What we did was we definitely started a partnership with the private sector. We have a very great Department of Health, but they don't have the manpower to deliver all the vaccines that we needed to. We have to give essentially 2 million shots, biggest public health initiative in the history of our state, in as short a time frame as possible, with all of the challenges, with some vaccine hesitancy, the reality that you couldn't do children. We have, of our 1.4 million people, 310,000 of them are under age 18. So only a few so far have been eligible, 16 to 18-year-olds with Pfizer. We opened that up to 12 to 15 as soon as the feds authorized that this week. That's another 55,000. So to get to herd immunity, we had to be pretty much perfect. And so we had partners with all of our hospitals. So a private-public partnership. They put a lot of resources in. We will help them financially. They needed to be open also. So it's in everyone's best interest to do it. So we have partnerships with Queens Hospital, Hawaii Pacific Health, Kaiser, the community health centers, which are geographically placed all across our state. And so we went very methodically. We started with our most vulnerable population and our essential workers. So we did our elderly, so first 75 up, and then gradually got down to age 65 and up. But simultaneous to that, because we had the lowest case rates and lowest mortality rates, we went to essential workers and workers like those that work in our hotels, because we knew that if we wanted to open up, we had to be forward looking. If we wanted to open up in 3 or 6 months, we had to have immunity for those individuals. So by opening the vaccines up to them, to of course, our essential healthcare workers so they could treat people, to the industry, it made sense. And though we didn't get all of the shots into the elderly all at once, they were already protected because we had the lowest case rate. So we were able to use common sense, and we also didn't have a rush like some states did. They were excellent in Nevada, but some states had such crazy lines and such competition with their seniors that it disadvantaged them. So we were methodical. We didn't waste any vaccine practically at all. And we were able to get to what we believe will be possibly the first state with herd immunity. We're thinking around July 1st, if we continue at this rate. So there are a couple different ways to approach these things. One is not necessarily more right than another, but the doctor and me wanted to make sure our elderly people were protected and those who were going to be most front facing, and that was this industry.
This has been fascinating. Thank you both. I'm going to close with this question, and it sounds like an easy question. Sometimes it's not. During the last 15 months, we can all think about all the bad things that have happened, right? In our industry, I know so many people that have lost their business. These are family businesses too, by the way. That's the interesting thing about our hotel industry. Most hotels are owned by a family. But there's also been some shining lights. There's been some things that have happened during this time of crisis that we sit back and marvel at, and we applaud, and we take out of this as a silver lining or something that we can be excited about. So first, I'm going to start with General Ford. Do you have any stories over the last 15 months of just good things that have happened, the goodness of the human beings that live in Nevada?
Oh, absolutely. There's so many. I just think about literally, again, this time last year when we started to see a lot of people do runs on the stores to buy up toilet tissue and everything, and you could hardly find anything on the shelves. But the frontline workers were still there. Kathy was a worker at the Smiths down the street here And I walked in one time and she was exasperated. You can tell that she had just been accosted by some folks and everybody was all, but she was still smiling. She was still smiling, putting forth the best effort that she could to help Nevadans, get what they were needing. And she and I just kind of took a breath together, stood 6 feet apart and took a selfie that I posted, just talking about the fact that, we're in this together. We have to remember that we don't have to, we shouldn't be nasty to each other right now. We're all trying to figure out this thing as it progresses. And so that's an experience that has stayed with me, in addition to a couple of companies that, you talked about at the beginning of the show here. You know who your friend, you find out who your friends are during some times of tumult. And we had a couple of businesses that literally took the initiative and reached out. They reached out to my office. Sharon Williams, as an example, reached out to my office and donated, and wanted to donate through me to people in our state, 5,000 masks and PPE. It was just, their own volition. This was not me asking them. This was them reaching out, saying, "Ford, we have a relationship with you, and we think that you can, we can put this in your hands, and you can be certain that it's put to good use." And so we were able to get those masks received and get them to our National Guard, who distributed those things. And it was, that was a great gesture there. And then the second company I mentioned by name is Aaron's Rents. Aaron's reached out to me because they had seen an article about, unfortunately, some of our homeless who were sleeping in the parking lot at a convention center during the height of COVID. And they said, they're sleeping on the concrete, but we make mattresses. So can we send you some mattresses to help out? And they did. They sent mattresses that we were able to get to homeless shelters, to battered women's shelters as well. And so looking at those companies, using their own impetus to reach out, I think are some shining examples of good things that came out of this crisis.
Green, what about you? You're a doctor, so you had to see some incredible stories.
I did. I saw a lot of courage from the nurses and the first responders and docs, and this ties into actually this industry too. We as physicians knew that we were likely to catch COVID, and I did, and others did, because you're just with a lot of patients that had COVID, and it came with a mortality rate that was not inconsequential. I lost a 51-year-old friend who was healthy otherwise. But what the hotels did is they stepped up, and they, for instance, did in Hawaii some programs like Hotels for Heroes, where the healthcare workers who we knew we might be positive, we want to take it home to our young spouses or our children, they put us up in hotels. So there was time where we might not see our families, we're on call a lot, but they made it possible for us to decrease spread and decrease risk. I mean, there are a lot of stories, like the Attorney General mentioned, just amazing small businesses. But, the hotels knew that we were all in this together, because my catching COVID could affect you, could affect your parents, could affect goodness knows who came through. And so it was really special. So I think they showed us that we're all interconnected, both from a health standpoint and an economic standpoint. And so that lesson, if we take that away with us after COVID, will be a silver lining for us.
Boy, I sure hope so. We all remember September 12th, when everyone was together. It may not turn out this way, but I hope and pray that whenever this is officially declared over, that we're more united than we were at the beginning. That would be a wonderful silver lining. Well, gentlemen, thank you so much for your leadership in your state, your leadership for what you do for our industry, and for, frankly, just being great guys to hang out with. This has been enjoyable. General Ford, thank you for your time. I can't wait to get back to Las Vegas, and we'll connect there. And Governor Green, we're going to spend some more time today together. So thank you both for being part of this. I also want to thank our sponsors again, as I mentioned at the beginning. Without them, none of this is possible. So for Food Buy and Hodges Ward Elliott, Spencer Stewart, thank you, and please keep them in mind. And we've got more of these series coming up, both the Forum series and Forward, which is advancing women in hospitality. So you can see right there on the screen, a very special treat coming up next week. Jill Ellis is going to join us, the winningest soccer coach in American history, and on a global stage. And so it'll be interesting to hear from her and everything that's happening with that. So again, for all of us in the industry, thank you for participating today, and we'll see you again next time.